Okay, are you ready to be excited?
Yeah. Do I have to ask you questions?
No, you better not. All right. You're gonna tell me when time's up or something, or let me know.
When you're at 3 minutes or what?
Yeah, because I'll try to go kind of faster than I read it last night. Okay, I'm not right now. Okay. Hi, my name's Andrea. On May 21st of 2010, I had a 5-hour surgery in which physician removed both my entire pancreas and spleen. I had suffered from pancreatitis since 17, which was about 14 years. At least once a year, I'd be hospitalized for 1 to 2 weeks, in which I would receive pain medication and nausea medication while I waited for the pancreatitis to subside. After over 14 episodes of pancreatitis, my pancreas was so damaged that my gastroenterologist, Dr. John Christine, informed me that I would need to have my pancreas completely removed. I was in shock, but I put my trust in the skilled surgeon and in God's healing grace. Having my pancreas removed made me an instant diabetic, since all of the body's insulin is produced in the pancreas. I had a new lifestyle to learn, and the path has been very difficult at times. A part of the learning process has included learning how to manage my diabetic condition and learn the health risks that I faced if I failed to properly manage my blood sugar. My research on the effects of diabetes on health issues includes studies and knowledge compiled from doctors, nurses, diabetes educators, and overall health experts. Having blood sugar levels which are too low or too high can cause temporary or permanent damage to your body. The damage may include temporary mental dysfunction, organ damage, surgery, and even death. My goal is to inform you on the importance of maintaining healthy blood sugar levels to avoid the risks of mental confusion, which can affect many aspects of your daily routine, temporary and permanent organ damage, which can cause further medical problems, surgery, such as amputation due to frequent unhealthy blood sugar levels, and death due to low or high blood sugar levels, or the resulting complications such as organ damage. When blood sugars become too low, the diabetic will likely suffer from mental confusion and or pass out. Reasons that blood sugar can become too low include taking more insulin than you're supposed to, not eating often enough, and pushing yourself too hard during exercise. During a time of low blood sugar, which is called hypoglycemia, the diabetic is not receiving enough sugars to keep the brain functioning properly. When the brain does not have enough sugar, it will process information more slowly and could also cause the diabetic to pass out. And this is information gathered from Rubin's book of Diabetics for Dummies, a very helpful book. Also, if a patient is going through a period of hypoglycemia, they should be treated by giving them sugar. It may also be necessary to call for medical help. Blood sugar which is too high, which I've shown here with the arteries, you have your red blood cells. If the glucose within the veins and arteries are too high, it can cause your blood to thicken. And this is a great cause of these problems here that we'll be going over. And it's extremely important that the diabetic continually check their blood sugar to make sure that their sugar levels aren't too high. Things which can cause high blood sugar, which is called hyperglycemia, include not taking medication properly, eating food high in sugar, not getting enough exercise, and also drinking alcohol. Short-term complications of high blood sugar can include feelings of irritability, hunger, thirst, and blurred vision, as according to Weiss and Funnell. This can help the diabetic become aware of the problem so that they know that they need to check their blood sugar. Some of the long-term complications of high blood sugar include organ damage, especially to the eyes, kidneys, heart, and blood vessels. And here are some of the different things, the different risks that can be involved due to high blood sugar. High blood sugar can damage nerves throughout the body, making it more difficult for the patient to realize there's a problem, such as getting an infection in the foot if you can't feel it, that can get infected If you have a cut, it can get infected and can even, in the end, lead to surgery. The seriousness of amputation can cause depression in diabetics or give them a hopeless feeling which might negatively impact their own self-care. Diabetics should remember to check their body for cuts and infections, as well as see a doctor regularly to avoid the terrible risk of amputation. If organ damage continues, or if the diabetic has an episode of extremely high or extremely low blood sugar, death could be the end result. The risk of death again points to the seriousness of controlling blood sugar levels. The result of death could be due to either high or low blood sugar and can be due to one bad episode or due to complications over a period of time. The most common cause of diabetic-related deaths is actually heart disease, which is typically from coronary artery disease, which leads to a heart attack, and that's from the buildup of glucose and plaque within the arteries. With all the information we've covered, I hope that you can see how important it is to manage healthy blood sugar levels. Having blood sugar levels which are too high or too low can cause serious medical problems that can affect the diabetic with short-term and long-term medical consequences. Although we haven't covered all the medical risks associated with unhealthy blood sugar levels, we were able to look at some of the more serious problems of mental dysfunction, organ damage, surgery, and even death. Diabetes is a medical condition which must be taken very serious to avoid both temporary and permanent complications. If you or someone you know has diabetes, please continue to educate yourself on how to maintain healthy blood sugar levels to avoid dangerous medical risks. Thank you very much for attending today.
What do you have? What's your time limit?
I can go up to 6.5.
6:26.
That's good. Okay.
How much you do it?
I wanted
without
to
your
comment
notes?
somebody.
Yeah, right.
I'm serious.
Stop
No,
that.
I'm not
Can,
doing it
does it
again.
have to go straight through, or can you cut?
Oh, I don't know. I'm not doing it again.
Why?
Because that was